Hi, my name's Patrick McCaig. This is my group living report for Liberty University. I held a substance abuse treatment group at Bay Pine Center on June 19th at 7 p.m. at Bay Pine Center in Escanaba, Michigan. I'm currently a supervisor at the facility, so I do have a decent relationship with the youth. It was 6 individuals, all from Wayne County. They reside in Detroit. Detroit is part of Wayne County, Michigan. So I was able to have a substance abuse group with these 6 individuals from Wayne County, 18 years and older. The group was on task. We do a lot of, or we have done over the years, a lot of group work at Bay Pine Center. It's a treatment program which is group centered. Everything is group work. I've done this for 21 years. I'm a firm believer in group work. I think it's very good, very effective. I know sometimes there's a need for individual treatment or individual therapy. I believe the most important, most effective is group work. Group work is very important to me. The meeting started out, it was healthy and positive. I have an individual who in the meeting is a leader. He kind of takes the other youth underneath his wing, or the other young adults underneath his wing. He is a former drug dealer. His mom was crack addicted. She passed away of an overdose. His grandma actually is the person that actually is one of the biggest drug dealers, from what I understand, in his area of Detroit. His dad is currently housed in Michigan Department of Corrections for 15 years or more, I believe, for drug offenses. So he's very knowledgeable. He was a heroin dealer. He sold some crack cocaine. Heroin has become very cheap, is what he's informed me, in the inner city. So there's a lot of people that are using heroin these days. So my biggest thing with the group was, if I'm looking back at myself, is being able to redirect the group. At times I'm a bit cautious about when to intervene, or I intervene too quick. So I want to make sure that I'm intervening at the right time, and as I go along, I'll get better at this, I believe. I'm not perfect. Nobody's perfect. There's only one perfect individual, and that was Jesus Christ. So I'm able to learn from the youth and help them with their treatment. I've run the 12-step program over the years. It's a Christian-based program. I'm sure you're quite familiar with it, as you know. So we do incorporate. Every youth is Christian in this group, so we do incorporate some Christian values. Fortunately for me, I've talked to my director and my assistant director, and they are well on board with this, holding these meetings once a week. I was able to we use a Hennepin County workbook, drug and alcohol workbook, which is very effective. It starts out with very basic, simple things, and then we work our way up as we go. So it's a good tool to use to help start and then work into different avenues of treatment. So one of the things that I do have to learn more about is the trauma. We do focus on a lot of trauma at Bay Pines, and everything is going to trauma, from what I understand, across the country. Trauma-focused treatment. So incorporating trauma into their lives is very important, and then that ties back into their drug use, and other crimes that they commit. So it's very important to focus and to keep the group on task at this, that I've learned. And I have to do a better job of intervening and redirecting and being a leader and making eye contact, and working on my leadership skills. And I think that'll come in time. Like I said, I used to do this years ago. I've gotten away from it, but as I do more group work and learn through Liberty and learn through the clients and some of my peers at Bay Pines, I think I'll be able to do a pretty good job. And like I said, I'll never be perfect because nobody's perfect, but everybody learns, and it's a very rewarding career, and I enjoyed it thoroughly, and I appreciate you giving me the opportunity to do this, and it worked out well for me, and I thank you, and have a nice day.